Your day of surgery actually begins the afternoon before. That is when you'll call the hospital so we can tell you what time you should plan to arrive for surgery. Your joint binder will have a sheet of paper reminding you where your surgery will be taking place, either at the main university hospital or at the orthopedic center where you had your clinic appointment. The phone numbers for surgery times are also listed in your binder. The night before your surgery, you will bathe with an antibacterial soap that we'll provide to you. If you don't have this soap already, expect to receive it at the Joint Academy. After you bathe, use clean pajamas and sheets for your bed that night, and in the morning, on your way to the hospital, you'll want to wear clean, comfortable clothing. Whether you arrive at the hospital or the orthopedic center, you will get started by checking in at the front desk, where you will present your picture ID, insurance card, and copay. We will confirm all of your information, including your emergency contact, and print out your wristband, along with a set of special labels that will help members of your team identify you and your procedure. Throughout your day of surgery and your hospital stay, we may ask you to repeat information such as your name and date of birth in order to double and triple check your care plan. We appreciate your patience. Once you've checked in, you'll be escorted to a preoperative exam room where we'll draw some final samples for your day of surgery labs. Your care coach is welcome to keep you company in the exam room during this part of the process. You will meet with members of the surgical team, including your surgeon, fellows or residents, and an anesthesiologist who can answer any last-minute questions you or your care coach might have. Last but not least, together with your physician, the joint we're operating on will be marked and your care coach will be shown to the waiting room. While you're in surgery, your care coach and any other friends and family who are waiting for you will be able to follow your progress using special digital displays which will indicate to them whether you are in pre-op, in surgery, or in the recovery room.